right? This one. Now, this toxin, this aflatoxin, right? What do you find? Why do you find this? Usually, these are actually you can find in stored grains or in nuts, right? And these are usually derived from, like, this comes from derived from aspergillosis, right? Aspergillosis, but found in let's just write down here, stored grains and nuts, all right? But it gives you conditions, this one. So it primarily affects this organ. And what is this organ? This is the liver, right? So it affects the liver. Now, this toxin, which are found in there, right? This can give you something called right here, hepatocellular carcinoma, right? Hepatocellular carcinoma. And you must remember this. It is high yield, right? Now, this is one of the chemical. You have to remember. Now, other one you have to remember here is this. Let's just write down another one. Not only this one, it can give you hepatitis. There are other conditions. Actually, let's write a little down here. Like, for example, arsenic. Arsenic. And if you remember arsenic, this play a very important role in causing different type of cancers. Arsenics, right? Where do you find this? It's found in herbicides, right? Vineyard worker, that one, right? Or groundwater, you can find this is, let's just say groundwater, right? Like wood, wood preservation, or even there, look, this is where you find, right? Arsenic. And one more thing you have to remember is that arsenic, if you remember, the pathway, the metabolism pathway, arsenic can inhibit the enzyme called, how you can run the glycolysis. What is the end product of glycolysis? It's pyruvate, right? Pyruvate can get converted into what? Acetyl-CoA by the enzyme called pyruvate dehydrogenase enzymes, right? And the arsenic can inhibit that enzyme called pyruvate dehydrogenase enzyme. Please remember that too. Yeah, that's very important because it basically what happens? It results into what you're not going to generate ADP. So there's a problem with oxidative phosphorylations that can be done by the arsenic, right? That's something that you have to remember, right? We have to tie in with the biochemistry. This arsenic plays, and these are the locations where you can find it, right? And they play a very important role in actually causing a carcinoma in 3 different organs. And that's something that you have to remember. One is this one. Again, liver plays a very important, remember. Liver. So we'll put let's just a red arrow there, right? Because it's going to cause there. But remember, arsenic does not lead into hepatocellular carcinoma though. Instead, it results into, all right, we'll just write down here, a little bit of blood vessels right here that's going to liver. And then you have, let's just say, endothelial, right? So you can remember this as it can result into, okay, we'll add a different color right here. We'll just write down a green here. It can give you conditions called, okay, hepatic, right? Angiosarcoma. All right, so it gives you, arsenic can give you something called hepatic angiocarcinoma, all right? Angiosarcoma now. Not only it can affect, the arsenic can give you a condition called hepatic angiocarcinoma. This arsenic can also play a very important role in giving you lung cancers, right? It can also affect something called lung cancer. So it can give you a lung cancer. So we'll write down here lung cancer, all right? Or it can give you hepatic angiocarcinoma, right? It's very important. And what else? There's also one more thing it can affect, and that would be a skin, right? And it can also affect, let's just write down here, it can also involve, we can make this as all right, we'll just make this as a skin right here. And then it's skin, right? So skin. So that would be this one right here, look. And it will give you squamous cell carcinoma. All right? So arsenic can affect 3 different organs. Liver, right? And give you condition of hepatic angiocarcinoma. It can give you, it can affect skin and can give you something called squamous cell carcinoma, and can affect also lung and gives you lung cancer, right? Please, arsenic, remember hepatic angiosarcoma. Now, not only arsenic can actually give you hepatic angiosarcoma, but there's another condition that can give you hepatic angiosarcoma. And what is that? What is that condition called? That is called, look, we'll just write down here, all right? Now, that is called venal chloride, right? This is basically vinyl chloride. Okay, this is CHLRO, right? This is vinyl chloride, and these are usually found in where? PPC pipes, right? These are usually found in PPC pipes, right? So we can say that these are found in PPC pipes, right? And this can also give you something called hepatic angiosarcoma. So please remember these two conditions, right? Arsenic and vinyl chloride, that gives you a condition called hepatic angiosarcoma. Must remember. This is like one of the most important things you have to remember, right? Now, you remember how we said that there is a hepatocellular carcinoma is there too? But hepatocarcinoma, like when it comes to chemicals, aflatoxin causes hepatocellular carcinoma. But now we have to tie back and let's just say the viruses. Like for example, we'll write down here other ones too. Like let's just say viruses like hepatitis A virus, hepatitis B virus, hepatitis C virus. These are RNA viruses, right? That can also give you a condition called hepatocellular carcinoma. Hepatitis B virus can also give you something called hepatocellular carcinoma. Right now, this is very much. Not only this, now we'll talk about what other chemical agents that can give you hepatocellular carcinoma. And that would be, another one would be, let's just write down here, we'll write down 2 point here. And that would be, actually, you know what, let's just write down this one as 1, right? And then we'll just write down this is a 1 here, this is like a 2 here, and then this is like a 3 here, right? And that would be like, let's just say ethanol or alcohol. Ethanol can also gives you a hepatocellular carcinoma. So this is organ liver, right? For the liver, you have to remember the cause of the hepatocellular carcinoma. Aflatoxin, please remember that. Hepatitis A virus, hepatitis C virus is an RNA virus. Hepatitis B virus is a DNA virus. Ethanol can give you something called hepatocellular carcinoma. This is high yield. You must remember that, right? And when it comes about like hepatic angiosarcoma, you have to remember arsenic and you have to remember the vinyl chloride. They both lead into what? That can cause hepatic angiosarcoma. Important. Now, this arsenic can also give you squamous cell carcinoma for skin, right? But also remember this, the non-radiations, like for example, UV light, that can give you conditions like squamous cell carcinoma, basal cell carcinoma, melanoma. Those are skin cancers. And those are the products that can actually lead into cancer, okay? So that is also something that you have to remember. Now, 4, you have to remember here. This is a 4 one, right? And this would be, let's just say, something called asbestosis. Now, what is this asbestosis? This asbestosis, right? Okay, let me write down here. Where do you find the asbestosis? Remember, these are usually found in, like, so we can say they're found like in constructions, like people who are doing like a cement and all, or you can find in the like people who make like shipyard building or produce, shipyard workers, or not only construction or shipyard worker, like a plumbing. Let's just write here. You have a plumbing. These are like, basically a construction worker, shipyard plumbing, or, people who do roofing, they also can find it. Old roofing materials. So you have old, like sort of like a roofing materials, right? That's where you can find something called asbestosis. And this asbestosis, right, that can give you something called cancer. But remember, this usually gives a cancer that primarily involves lung. Right? Primarily involves lung cancers. Now, if you look at this lung, right? Lung has different lobes, and you have to remember this is a very important point. Usually this asbestosis, right, that affects this lower lobe, right? It affects the lower lobe. Please remember that. What does it affect? Asbestosis, you can think of this as a base, right? So it affects the base of the lung, right? And these are locations where, you can find it. And these asbestosis give you lung cancers, right? It can give you lung cancers. And primarily, it can give you a lung cancer that is called, let's just say, obviously, it gives you something called, let's just say, bronchogenic carcinoma, and also something called mesothelioma. You have to remember this. It's a high yield. Very, very. And what is mesothelioma? Is basically, there's the layers of cells like this, they have Visceral layer and parietal layer, right? This parietal cell layer, the serosa are lined by the mesothelial cells, right? It's because of that mesothelioma can be given by this condition called asbestosis, which primarily affect what? Lower lungs. Please remember, you have to remember what organ is affected, and that's very important, all right? Now, after this, not only this one is there, you also have to remember this one is very high yield. And I have to make it actually, let's write down here, we'll write down 5 here. And that is tobacco smoking. All right, tobacco smoking. They're just like a cancer-producing agents. Now, this tobacco smoking, what can tobacco smoking lead into? Look, one more thing you have to remember is that whenever you smoke tobacco, right, they produce a products, right? Whenever you put it, that produce, what is that product called? That usually produces something called polycyclic, like polycyclic aromatic hydrocarbons. All right. Now, these are these can lead into damages to different organs. And remember, if you have like tobacco smoking, right, that can damage this organ right here. What is this called? Kidney. All right. It can affect kidney, and it can give you a kidney. And what are the things it can give you? So we'll just write it down here. It can give you something called, okay, let me write it down. Like it can give you condition. Something called renal, because it affects kidney. So renal cell carcinoma. All right. Number 2. Not only this can affect, it can also go and affect, what is this? It looks like a bladder to you, right? Urinary bladder, right? And this urinary bladder is lined by what kind of cell? Transitional cell, right? Transitional epithelium, or we also call them a urothelium. It's lined by that. So this condition that can give you a cancer, that is called very, very important high yield. This is called transitional. It's a transitional cell carcinoma, right? Or we can also call them a urothelial cell carcinoma. Please remember this, that tobacco smoking in bladder, right? It's affecting bladder. You have to remember this. This is a bladder, right? It's a bladder. It is affecting bladder, but in bladder, this tobacco smoking is not leading into squamous cell carcinoma. Please remember that. Bladder cancers are different. They're different types. There are 2 types you must remember. There's a transitional cell carcinoma, and other one is a squamous cell carcinoma. Right? So bladder cancer. If it's squamous cell carcinoma, then that's not caused by this one, tobacco smoking. Okay? Please remember that. The squamous cell carcinoma of the bladder is actually caused by this guy right here, this parasite right here. What is this called? And this is very high yield. Okay, this one. And what is this called? Okay, we'll write it down here. It's called, look, cystosoma. All right, this is a parasite. Okay, it's a helminth that gives you a condition called, let's just say, squamous cell carcinoma of bladder.